In this day and age of smartphone texting, video game controllers, computers, the keyboard, mouse, and even the mousing surface on your laptops, it's no wonder so many people have pain in their hands and wrists. At first, you might chalk it up to sleeping funny or an overuse injury from your yoga class, but if the pain endures, and depending on the specific mix of your symptoms, you may be wondering whether it could be carpal tunnel, a form of arthritis, or something else. In this video, we are going to discuss wrist pain, flick sign, Tinel sign, and prayer stretch in carpal tunnel syndrome. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash the like button and subscribe to never miss out on any of our videos. Wrist pain is a common condition with various causes. The wrist joint plays a role in basic movements, from texting to writing. When pain occurs, it can interfere with day-to-day activities and even impact a person's quality of life. Made of dozens of small bones, our hands and wrists can easily get sore. The wrist alone has 8 bones lined up, 4 on top, 4 below. All 8 bones are connected by ligaments that keep the joints together while giving a wide range of motion of our hands. There are also many tendons that pass the wrist. These control the motion of our wrist, fingers, and thumb, because each of those parts serves a purpose in movement. If even one area in the wrist gets inflamed or injured, you're going to feel it. The carpal tunnel is an important passageway of the wrist containing the 9 flexor tendons of the fingers and hand, as well as the median nerve. Being overweight is a consistent risk factor for CTS. Greater body mass appears to reduce the speed of nerve messages into the hand. Obesity is also related to poor physical fitness, which may increase the risk. Weight is strongly linked to CTS in patients under age 63, but it may be a less important factor as people get older. Workers in the meat and fish packing industries and those who assemble airplanes have the highest risk for CTS. According to one study, meat packers complained of pain and loss of hand function as long ago as the 1860s. Even today, the incidence of CTS in the meat, poultry, and fish packing industries may be as high as 15%. CTS most commonly affects people aged over 45 years, with a peak incidence at 46 to 60 years, and has a higher prevalence among women. Described as an occupational overuse syndrome or a technological disease, the incidence of CTS is rising in the UK, with its prevalence in the UK between 7 to 16%. Carpal tunnel syndrome accounts for 90% of all peripheral neuropathies, and its lifetime risk increases from 10% to 84% in patients with type 1 diabetes mellitus. Diagnoses include a physical exam of the hand, arms, shoulders, and neck. The doctor will examine the wrist to see if it is tender, swollen, warm, or discolored. The exam will include testing each finger for sensation and testing muscles at the base of the hand to see how strong it is. The doctor may test for thumb weakness by asking whether you can raise your thumb from your plane to your palm and stretch your thumb so its pad rests on the little finger pad. Another test of carpal tunnel syndrome is called the flick signal. The doctor asks what you do when your symptoms are worse. If you respond with a motion that resembles shaking a thermometer, that is a strong indication that you may have carpal tunnel syndrome. Patients should be evaluated for the presence of hypalgesia, diminished ability to perceive painful stimuli, along the palmar aspect of the index finger compared with the ipsilateral little finger of the affected hand. A 2-point discrimination test in which the inability to discriminate points less than 6 millimeters apart is considered abnormal can be performed with a caliper. The abductor pollicis brevis may display notable weakness on strength testing. Fallon maneuver and Tinel sign have been used to observe the reproduction of the patient's symptoms when the wrist is placed in flexion or when it is precursed on the volar surface, respectively. However, Fallon maneuver, Tinel sign, presence of thenar atrophy, and history of nocturnal paresthesias have little diagnostic value compared with other history and examination findings. The first step in treating shooting wrist pain is rest. Minimize the use of your wrist and stop any activities that are causing obvious shooting pains. Whatever the cause of your wrist, elbow, or hand pain may be, physical therapy can help. In fact, early intervention may help you avoid surgery. Oral corticosteroids produce significant short-term symptom relief, with benefits waning over a period of 8 weeks after medication is discontinued. In contrast, non-steroidal anti-inflammatory drugs, diuretics, and pyridoxine, vitamin B6, have been shown to be no more effective than placebo. Splinting is a first-line treatment for mild to moderate CTS because of its simplicity, low cost, and tolerability. A 2012 Cochrane review found nocturnal wrist splinting to be more effective than placebo, but found insufficient evidence to recommend one splint design over another or compare the effectiveness of splinting to other conservative interventions. However, one study showed that patients wearing a neural wrist splint were twice as likely to report symptom reliefs compared with patients wearing an extension splint. Splinting is advisable in reversible cases of carpal tunnel syndrome, such as in pregnancy, and can be combined with other treatment modalities. Intrinsic patient characteristics clearly influence the development of carpal tunnel syndrome and likely determine what degree of environmental exposure, if any, is required. Hakim and colleagues studied the relative risks of carpal tunnel syndrome in female monozygotic twins, dizygotic twins, and singletons. They found heritability to be the strongest determinant of carpal tunnel syndrome, conferring approximately half of all risk. Phelan et al. Reported the first trial of hydrocortisone injections into the carpal canal in 1957. Since then, studies of the effectiveness of local corticosteroid injections for the management of carpal tunnel syndrome have used differing steroids, doses, injections, sites, and baseline severity of symptoms. A review of report found that local steroid injections do provide clinically significant symptoms relief after 2 and 4 weeks compared to placebo, but benefits beyond 4 weeks remain unclear. It also remains unclear whether the severity of pre-existing carpal tunnel syndrome symptoms affect responsiveness. Local steroid injections is more effective than oral steroids in reducing symptoms at 3 months. The location of the injection into the carpal tunnel at the wrist crease versus 4 cm proximal to the wrist crease has no effect on response. There is no evidence to suggest that one type of steroid, longer acting versus short acting, or the dose of steroid is superior to any other. Lower dose and higher dose injections appear to have similar benefits. 2 injections, done sequentially, do not appear to provide any additional benefit over a single injection. The severity of symptoms, response to other conservative measures, and risk factors for complications such as bleeding and infection should be strongly considered when identifying candidates for this treatment. Providers should also consider that symptom improvement from a local steroid injection is not significantly different than oral NSAIDs combined with neural wrist splinting after 8 weeks of treatment. Neuropathy is decreased or distorted nerve function. It particularly affects sensation. In autoimmune diseases, the body's immune system abnormally attacks its own tissue, causing widespread inflammation, which in many cases affects the carpal tunnel of the hand. Such autoimmune diseases including rheumatoid arthritis, systemic lupus, erythematosus, and thyroiditis, which can lead to hypothyroidism. Some experts believe that carpal tunnel syndrome may actually be one of the first symptoms in a number of these diseases. Studies also suggest that carpal tunnel syndrome patients with these disorders are more likely to have severe carpal tunnel syndrome that requires surgery. Arthritis, gout, and other medical conditions that damage the muscles, joints, or bones in the hand may cause changes that leads to CTS. People with chronic kidney disease who are on hemodialysis for a long time often experience beta-2 microglobulin amyloidosis. This condition arises from the buildup of a certain type of protein called beta-2 microglobulin in different organs, including the joints of the hands. This buildup can result in carpal tunnel syndrome. Prayer stretch is a great choice of stretch for targeting the wrist pain. The prayer stretch gives your lower back a break from supporting your upper body and is often used to help to relieve pain and build up tension in the area and reduce the risk of future injury. Put your hands together under your chin in a prayer position. Push your hands down to your wrist until you feel a moderate stretch. Hold for up to 30 seconds. Repeat between 2 and 4 times. Some experts recommend doing this stretch a few times each day. You may want to do it before any activity that tends to aggravate your carpal tunnel syndromes, as well as any stretch or exercise. By encouraging blood flow through movement, whilst also building strength, you ensure muscles aren't left neglected and lessen the likelihood of injury to these areas in the future. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Do not forget to subscribe to our YouTube channel. Stay safe, and we'll be back soon with another video. Please click on the next video clip to watch for more health info. Thank you very much.